welcome all who came onto this call. I know we have participants who are from across the county, executives from our hospitals and health systems, as well as clinicians who are seeing patients on the front line, and also some public members, some leaders and stakeholders with our community-based organizations. Thank you all for coming onto this call. I felt like it was necessary because we're in such uncertain times, and it's really helpful to hear for people with what's going on. So really that's what this is all about. I don't have all the answers, but I will hope to provide you at least a little bit more about information about our county, about our agency, and some of the trends that we're seeing, and also what public health has in store. Because this is a continuing medical education activity, I do have to present my disclosures. And so on the next slide, you'll see a list of some of the companies that my family has decided to invest in. I do allow for my children and my husband to decide on whatever they want to invest in. So that's some of the list of health-related investments that we have for stocks. Next slide. And again, if you are a clinician and you desire CME for this activity, we do have CME, but you do have to remain on the entire webinar, and then you will receive an email to ask them, and you'll just have to answer those questions to then receive CME credit. And during this talk, I do intend to go over our health data in Orange County, our health rankings, life expectancy, what we're seeing in children and older adults, and then leading causes of death. After that, we'll go over some ongoing challenges that we have been addressing from the behavioral health aspect, as well as some infectious disease trends. And then what we're doing on the readiness and response. And then maybe some still current and emerging challenges and the opportunities that present itself, and what you can do to get more involved and where to get information. For nurses, I do see on the chat there's a question about nurses. We only requested for CME, but if you don't mind, if you're a nurse, go ahead and click on the CME and we'll see what we can do. So the next slide here, this is just telling you about the healthcare agency. We are a large agency. We have over 3,000 staff. And I am just one of many leaders here at the agency trying to do the good work. So you see here, our director is Dr. Veronica Kelly. She previously was the director for behavioral health services and now leads our agency. And her assistant director is Lorraine Daniels, who has a history of working with SSA. So she really knows our county well. And then you see there in the orange, I had to highlight myself and the county health officer and the deputy health officers. We have the privilege and honor of having the duty to protect and promote public health across Orange County and the cities. So while I have the county health officer name, I am also the county health officer for the cities of Orange County. And we really, from our perspective, are supposed to guard public health. Also, there's broad authority to addressing communicable diseases and controlling that, as well as responding to emergencies. We have a behavioral health team that consists of well over 1,000 employees, and they provide services to youth, children, adult and older services when it comes to behavioral health. They do substance use. They also have substance use disorder services and much more, as you can see there. We also have a director of correctional health in our correctional health services with a staff of over 500, and they serve all of those who are in our jails in Orange County. So thank you for serving those in most need, especially in our jail settings. We also have specialized medical services that involves our emergency medical services, our California Children's Services, Office of the Public Guardian, and then medical safety net and employee services, health services. And then we have now the director of public health and nursing services. And I know I held both the health officer and the director of public health role for a little bit over a year, and I'm so glad that we now have a director of public health services who really knows public health and is a public health nurse herself. We have clinical services, community nursing services, as well as health promotions community planning, and our communicable disease control division, and our public health lab, as well as our environmental health services that all fall under public health. We also have our Office of Compliance, and then our Deputy Director of Government Affairs and Communications, which has really been helpful, especially this year as we face a lot of legislative and policy changes from the federal level. So really, this is the big overview of our agency and what we do. Next slide. A little bit more about health officers. Unfortunately, many of you who are listening on the call may have not known what a health officer was. I know when I was seeing patients, I didn't know what a health officer was until COVID hit. And then all of a sudden, we found out the health officer is the one who can call emergencies and local health emergencies and tell us what we should do, what the best practices for our community to safeguard our health. But joking aside, it is a very important role and position that I'm supposed to be a physician, right, in the health officer position, because I have to understand the broad range of impacts to our community. But as a health officer, I also hold the legal authority to determine when a health emergency needs to be called, to determine what to do when there is a communicable disease outbreak and what measures need to be taken. But I don't do that alone. I have a whole team that helps me with those decisions. And as pictured here, we have Dr. Zahn, who is an infectious disease preventionist, has been with the county, has been doing public health for many, many years and really understands infectious disease. He also sat in the CDC and sits in the CDC ACIP committee for determining and recommendations for vaccines. We also have Dr. Alma Sheikh, who is a trauma surgeon and really has been in the community working on Stop the Bleed efforts prior to coming to public health. Really honored to also have her join the team because she provides a different perspective on preparedness. So I'm your health officer, but I also have assistance from the deputy health officers and many other clinicians and experts across the agency who help with decision making. So I'm sorry, I do see on the chat that we're having some interpreter challenges. I'm going to keep going because there is just so much information to share with you. So now that I've talked a little bit about the health officer role, I really want to talk to you all about who I am, because I know my patients know me, and my friends and my family know me, but many of you may not know me and what drives me. I know it's important to understand my background to know that I really have the best intentions to keep our county safe. So I am a board certified family physician. I didn't always think I was going to be a physician. I actually started off thinking I was going to be an athletic trainer. And it was in caring for others in the athletic training role that I decided maybe I wouldn't go the traditional route in becoming a physician and became an osteopathic physician because I really believed in utilizing all the different tools we could to achieve health. Also, it was as an athletic trainer, or when I was trained to be an athletic trainer, that I learned about acupuncture. So I really sought to learn about alternative treatments, again, finding answers for my patients. And I trained in Camp Pendleton Naval Hospital, very proud of that. As I come from a military family, it was really natural for me to decide on joining the military and serving our country. And it was during my military service that I really had the honor and privilege to serve our veterans, our service members, and their families. I learned a lot about population health, or at least community health, because as a family physician in the military, the responsibility was both to the patients, the service member, the family, as well as the entire base that you were in charge of. For Camp Pendleton, I actually was the diabetes champion. So I was looking over all the A1Cs across all of those we gave service to, even if I personally didn't see those patients. So it was a medical home model, very, and I felt like it was value-based. And we were really addressing everything for our community. But fast forward, I ended up leaving the military and then serving locally. I'm not going to mention which hospital, but you can Google it up. I did help out with creating innovative clinics to again search for answers for patients. And those clinics then transitioned to urgent care clinics, which was very timely for COVID. Um, and during COVID, because I was also caring for patients, also overseeing a lot of urgent care centers, and also providing care from an integrative model, I had a different understanding of COVID. And so as soon as I saw those inflammatory markers in some of my patients, I was really concerned about the long-term impacts it would have on our community. And it was in finding different ways and solutions of trying to get better testing or more testing ability for COVID that I found myself then applying to the county, the healthcare agency, because I really felt that we needed to control the disease and do more. Um, so here I am. Fast forward, it's been quite a ride. November 2020 was when I joined the agency, and I'm now your health officer. Um, but really honored to be that. I've learned a lot more about the agency also as I've been here, and the rich history that we have. If you didn't know, Orange County wasn't always a county. We were apparently part of LA. But because of that innovative spirit of our leaders and the settlers here in Orange County, we branched off in 1889 because we wanted, apparently, the settlers and the founders wanted a different future for Orange County. They called it Orange County because not because of the oranges that were here, because there were actually no oranges, but because they thought of it as a paradise that they can create, a destination for everyone, especially post gold rush. So here we started as a very innovative county with a lot of strong, actually, medical leaders. Um, our first health officers didn't even have a public health department, and they were um, tasked with trying to control disease without a department and seeing patients, and also had to care for the most needy. Apparently, the initial hospital was a farmhouse, but also we also had a room in the courthouse, the old courthouse, and they also cared for those who were in jail. So we've come a long way. I think the longest serving health officer served the county for over 30 years, and there's a lot learned from that time. Um, but anyhow, I digress. I know there's a lot more to talk about. Um, we have so many great physicians here. So I'm going to move on to the next slide, which is our history. So 1889, that's where we started. And when you look at the 20th century, there was so much that our predecessors had to deal with. They had to deal with the Spanish flu. They had to deal with diphtheria, that causes strangulation almost in kids who were affected, measles, polio, a lot of sanitation related issues, and hence environmental health also had its early beginnings with the development of our public health department in 1922. They had typhoid epidemic in Santa Ana in 1924 because of contamination of the water system and contamination of milk sources. So there are so many struggles that they had to overcome, but they overcame it with minimal financial support. Um, and, and and again, in that innovative spirit, we're able to still take care of our community. And I'm hoping that you'll see that no matter what happens with what's going on federally or even statewide, we will remain true to our core of taking care of the community. Next slide. So I love this table because it really shows the impact of what we can do in public health and how it's impacted the lifespan and life expectancy.
역사가
Here you see that
되겠습니다.
during the 20th century,
수명의
early on 1900s, beginnings of Orange County, we had such a low life expectancy, 47 years. I know about
수명이
you, I'm 46. So that means
짧았습니다.
and
어,
then how much life to live, right? Like we're living in the
87살까지밖에 살지를
1990s.
못했는데요.
But with all the different
아,
innovations and advancements in public health
1900년도에
treatments and
다른 그런
understanding
혁신,
disease and how it affects us, many different things were put in place, policies were put in place to safeguard the public. So that's where vaccinations were improved upon. There was fluoridation of the drinking water, which reduced dental cavities. And we know that dental cavities, when they're not cared for, can result in other negative impacts to the health, especially your cardiovascular health. There's motor vehicle safety,
Nhưng mà
recognition
nó
that
có những
tobacco is really a hazard. It
những
can
cái
cause lung
ngừa
issues,
cho những cái
family
bệnh
planning,
sinh viên
healthier mothers and babies.
차들도
bệnh
많이
những cái
있었고요.
asthma.
And then over time, then when as we addressed all of these issues, the life
그 시간이
expectancy
지나면서 이런 모든
um, okay, so next slide, where we are today. Today, we are
오늘
a thriving
Những
community.
cái
We are a thriving
gì
agency. We have
chúng ta đang cố
over
gắng để
3,000 staff,
ờ,
over
biết
31
hơn
facilities across the
cho người
county,
và
serving the
sống ở đây,
community.
và
And
chúng tôi
pictured
đang cố
there in the
gắng
middle,
giúp đỡ
on the
cho
top
cái
middle,
quận
is
Cam
our newest
của chúng
facility,
ta. Đây
which
là
really
cái
houses our lab
bên
and
bên
our
trái thì chị
coordination
thấy đây, đó là cái chỗ
for
mới nhất của
emergency
chúng
medical
tôi,
services. So
đó để mà có thể
technically,
phần
it's
cấp
kind
cứu
of out in the,
cho
it's not
những
really
người trong quận của chúng
a
ta.
service place for the
Thì cái
public,
đó
but
là
we're in the
không
background doing
phải
all the
là
hard work
những cái
to keep our public
cho
safe.
cộng đồng,
You'll see
nhưng
our
mà chúng tôi
environmental
là
health
những người làm ở mặt
department
sau nghiên cứu
building there too that
uh,
provides a lot of
của
services.
chúng ta.
We actually have compared to other counties, we have a smaller team that has been able to transition to meet the demands of our county. We have thousands of restaurants, a lot of growth in development and businesses, and our environmental team works around the clock to look at all the different plans that businesses have to make sure that they are building at a level that is going to be protective, and also that our restaurants operate in a safe manner. And then on the top right, you see there are clinical services at 17th Street that continues to serve the public and provides vaccinations, also provides TB control care and pulmonary disease care specific to TB, HIV and STD services, and much more. All of us, no matter which department, we're all specifically focused on public health. And even though our different departments may not be labeled public health, we are the big public health, big P public health, where we're all focused on the determinants of health and how it impacts health. So that's just a little bit about us. Now I'm going to go into the
Biết
data.
về thông tin về chúng
So
tôi.
there's going to be a lot of data, so hang with me. Okay, I'm going to try my best to get through this, and even if I don't,
សុខាភិ
we
បាល
will
សាធារ
have
ណៈគឺជា
a
ដែន
version
ក្រ
of
ម
the
ដែលពួក
slides
យើងទាំងអស់
available
គ្នា
for you
មាន
to
ការផ្ដោ
look
តសំ
at.
ខាន់ទៅលើកត្តា
I'm a
ដែលប៉ះ
family
ពាល់ដល់
physician,
សុ
so
ខ
I
ភ
like
ាព
everything
និង
in
វិ
one
ធី
place, and we've got
ដែលមាន
thousands of
ឥទ្ធិ
reports
ពល
from the
ដល់សុខ
county, and
ភា
I'm
ព
trying to distill it all for you
그다음에
today.
저는
It's a big ask. But anyhow, the good news with Orange County is I think we kind of lived up to some of our founders' vision. We have improved our life expectancy, and you'll see in the next slide, we are doing a great job, at least according to the county health rankings roadmap that's created by that's an annual report published by the University of Wisconsin Population Health Institute, and that is supported by the Robert Wood Foundation. What it does is it utilizes a lot of different community conditions, social determinants to determine which counties are rating the best and the worst. And unfortunately, because of funding cuts, this is probably the last county health ranking roadmaps we're going to receive from that organization unless things are changed. But you'll see here, Orange County does have is one of the healthiest counties. You see there, we're in green. We are above our state average, and we are above our national average. And according to this report, they took into account life expectancy as well as quality of life, the amount of parks and access to being physically active, obesity, HIV prevalence, diabetes prevalence, suicides, all of that to determine our county ranking, and we actually ranked very well. Next slide. And then you'll see here, this is from the California Department of Public Health. California and Orange County saw a reduction in our life expectancy in 2020, and that was a direct result of the COVID pandemic. But you see there in 2022, we started to pick up and improve our life expectancy, and hopefully we'll get back on track and get it back to where it was back in 2017, 18. But you'll see there's differences, right? Depending on your ethnic background. Asians, in aggregate, have the highest life expectancy. And why I say aggregate is Asians really represents many different groups. And when you break down those groups, there are going to be differences. So that we know that our Native Hawaiian Pacific Islanders don't have the life expectancy as the rest of the Asian groups. They do have some health disparities, and there's so much more to understand about that. And then we know that the Black community, unfortunately, have the lowest life expectancy, and they have had the lowest life expectancy. So more efforts obviously need to be focused in on improving things so that they can have an improved life expectancy. And then you see there the total, and the Latino also had a very high life expectancy, and then closer to the pandemic, you see a drop. So again, we need to focus on efforts to help that community out. And then you see the white community that has been pretty level and stable. So again, depending on your background, life expectancy may change. And again, this is an aggregate. And I know that we need to disaggregate the data to get more clarity. Next slide. For those of you who are interested in the health of our children, and I hope you all are, because they are our future, the Conditions of Children report releases every year, and it's a great summary of what's happening in Orange County, the demographics of our pediatric population, as well as the social determinants that are impacting them, their educational achievements, the safety of our communities. So it's a great report for all of you to look into. And I want to highlight that, the good news is that, at least at the time of this report, the percentage of uninsured children was showing that it was continuing to drop 3% to 3%. Unfortunately, with all the different federal changes, that might change. And so again, we need to, as a community, look at ways to protect that group. Also, we saw that rates for a 2 to 5 year olds enrolling in licensed childcare were at a 10-year high. This is great because then it allows them to be engaged with other peers, and then on top of that, parents can also work. On the education standpoint, Orange County high school graduates consistently had higher rates of college readiness, which is really good for our county. As we hope that they will come back to our county, right, and provide services to us once they finish their college degrees. As far as safe homes and communities, the rates of foster care placements and permanent homes within the 12 months of this report showed improvement and exceeded the national standard, and juvenile crime rates also decreased, which is great. But you'll also see there that there's room for improvement. There's room for improvement when it comes to the percent of preterm births, the rate of infant mortality, and then behavioral health hospitalizations related to serious mental illness. And then also there's still room for improvement when it comes to just doing the regular daily reading. We know that reading really improves the relationship a child has with their parents, and also improves their academic achievement. And unfortunately, we saw in this report that the food insecurities actually increased, and unfortunately, we're going to see that it's going to increase even further, especially as we head into uncertain times economically. Next slide. Okay, so this is Orange County and our pediatric population and the death trends, as well as infant mortality rates. And again, you'll see there's disparities depending on which ethnic background and which year. You'll see that again. So Asians have the lowest infant mortality, and again, that's an aggregate. That's not bringing them further down, but you'll see then when you break it out into Native Hawaiian and other Pacific Islanders, they unfortunately have a higher mortality rate than Asian groups in between 2020 and 2022. And then you see there Hispanic and Black are at the same level. So there's still a lot that we can do to really improve that, but that also requires research. So we do need our assistance from our academic partners to really understand what's causing those trends. Next slide. Part of public health is having a maternal child adolescent health program, and here in Orange County we are getting ready to release this maternal child adolescent health needs assessment summary report. It was a report done after convening a lot of different community members to get a better understanding of what priorities we should focus on when it comes to moms, babies, families, to really, again, protect our children. If you didn't know already, we also have everyparentoc.org. This is a website, it's a resource created with the help of our Orange County Perinatal Council, as well as many different other groups that collaborate and meet regularly. It was the Orange County Perinatal Council that came together when we had the formula challenges and the shortage. They also come together to talk about other metrics and best practice with protecting the maternal, adolescent, and child population. They talk about Black infant health and, again, the importance of improving outcomes for that community. There's so much more that they do, but I encourage you all to look at that website, Every Parent OC, for more information. As you see here, what's identified as a top priority is mental health. Mental health, mental health, mental health. So the good news is that we have a county that has been innovative. We have one of our largest departments in the agency is our behavioral health services that focuses on mental health services for the community and collaborating with the community. Next slide. So aging population, I had to put this in because we know that our population is aging, and I pulled out from our Orange County Business Council's Community Indicators Report, which was published for 2024-25, and you see there in the middle that blue line where right now, or at least in 2024, 65 and older makes up 17% of our population, but it's predicted to make up over 31% by 2060. And it will surpass the 25 to 64 age group, which is our working group. So we know that with an aging population, there are going to be more resources that are needed for that population to care for them. And the Council on Aging actually also published the Orange County Older Adults Needs Assessment Report last year. And they did a survey across caregivers as well as older population to understand what are their concerns and what are their needs. And again, you'll see a lot on the behavioral health side. A lot are really concerned about their memory loss, as well as other specific conditions like Alzheimer's and cancer, heart disease. And there are a lot of barriers they're also concerned about, including access to care, appointment times that are convenient to them, knowing where to get help, and then the high cost of care and the need for transportation. So encourage all of you to read that. I know that it's a concern for all of us, especially those of us who have loved ones who are also aging. We want to make sure they get the best care that they can, while also allowing us to work so we can keep the lights on at home. Next slide. So now I'm going to go into some of the death data. So the total number of deaths in Orange County pretty much prior to 2020 was in the 600s. And then unfortunately it climbed up to above 700 and has maintained above 700. We hope we can get it back down. But when you compare this to our early days, of course, we've made significant improvements with reducing death rates, but it is still a problem. And when we look at death rates, let me look here at my notes. Heart disease and cancer are leading causes of death. Actually, we'll go on to the next slide so we can see that. So in the leading causes of death, we see heart disease, and this is for the total population, so all ages. Heart disease leads, and it has been the leading cause of death for the last 50 years. And then you see cancer and Alzheimer's, that yellow line. And then stroke, and then accidents. And COVID-19, you see that drop after 2021, which is great. But again, there's still a lot of other things we need to worry about. Heart disease, we know, is related to our lifestyle and also, genetic factors, but mostly lifestyle. And cancers can result from genetic factors, but also can be from environmental factors. There's still much more to learn about cancer. And then Alzheimer, as we have an aging population, we also know, again, lifestyle also relates to Alzheimer's disease. Next slide. So this is by age group. I know this is a very busy slide, but it helps break it down by age group. So when you look at 0 to 4, the infants and the toddlers, the leading cause of death for that group is going to be neonatal conditions and congenital anomalies. And then I know you see that there's a asterisk there for age 5 to 14. The reason that there is an asterisk is because the data is suppressed because of the very small numbers, but we'll see in the next slide some other causes of death for that age group. And then you see young adults to the working adults. Drug overdose across the board has been a leading cause of death. Then you see road injuries, suicide, alcohol. And then when people become 45 and older, then that's where you start seeing the lifestyle impacts, the cardiovascular disease, strokes. But then you also start to see cancers pop up. And unfortunately, lung cancer still ranks as the top 5 for 55 and older. But luckily, we have seen a significant decline with all the tobacco prevention efforts. And we hope that, again, lung cancer will be kicked down to maybe beyond 5, but there's still a lot of work to do. The other issue we have here in Orange County is just the traffic, right? So there's a lot of other things that can impact the lung cancer. And then you see here Alzheimer's and COPD. Next slide. Okay, so I had to put behavioral health first, just because you saw in the leading causes of death, you saw that drug overdose, suicide were top for especially the young adults and middle age. So really want to focus on what's happening here with suicide rates. So those greater, what we saw is that from 2001 to 2023, suicide death rates increased by 32%. And between 2001 and 2023, approximately 300 lives were lost to suicide each year. That's a lot of lives lost. I unfortunately have a close friend that passed away from suicide, so it hits home. Age groups. So those age 65 and older continue to die by suicide in the greatest number in Orange County. 23% of all deaths in 2021 to 2023 were among this age group. So we really have to worry about our 65 and older to make sure that we are supporting them. And then compared to overall population size in each group, when we look at 55 to 64-year-olds, they had the highest rate of death from suicide, followed by the 25 to 34-year-olds. And then for our youth, the youth age 10 to 17 and young adults 19 to 24 had the lowest rates of suicide. And then I think that's what we have. So in terms of older adults, highest rate was still among, or sorry, I'm going to go by ethnicity. Highest rates of suicide death were still among the white residents in Orange County. And then Black residents were the second highest. And then unlike other races and ethnicity groups, the rate of suicide amongst Asian residents has been increasing. And suicides are higher among males compared to females. And you'll see that the right, I know it's blurry to you. We do have a suicide dashboard, so you can look at that on our website to really tease out what has caused, how are people committing suicide. Unfortunately, there's many different forms of that people are using to for suicide, and that includes firearms. So firearm safety is definitely something to be considered if there is a firearm in the home. Next slide. Behavioral health and the number of drug and alcohol deaths. What we see here is that there are improvements, right, with some of the uses, but there's still also increases. So we know that there's a lot of alcohol, opioid, cocaine, stimulants, sedatives, and unfortunately also inhalants are another substance that is being used. I'm going to move on to the next slide because I want to talk about something more positive. Getting me sad just looking at all these numbers. So when you look at opioid-related overdoses, as you know, we have the Fentanyl is Forever campaign, and that was a community-wide effort to really focus in on how opioids has been causing a lot of deaths, especially with fentanyl. The good news here is you see a downward trend. You see a downward trend, especially amongst our youth and young adults, as well as just overall. On the far right, you see that we have reduced the fentanyl deaths compared to 2021. And again, that's from all the hard work on the ground and dispelling the myth that, I mean, just talking openly about it and having more naloxone available. And just know if you need naloxone training, we have that, and we have a slide later on, so you can contact us if you want us to assist with that. And you see we are doing well compared to California and the nation. That's the bottom slide there, when the yellow. And then when you look at the upper slide there, again, the preliminary data for 2024 shows a decline in overdose trends. So that's definitely a positive for all of those out there on the grounds working on this. Thank you, thank you, thank you. Keep it up. We still have a long way to go. And I know that there are many communities that still need help. Next slide. Oh, sorry, wait, hold on. Okay, so this is an emerging issue, nitrous oxide and the recreational use of it. I want to thank the Board of Supervisors for letting me know about this problem. I actually didn't really know this was a problem until I looked further into it. And as I looked further into it, if you don't recall, it was around February this month that our Board of Supervisors put an ordinance in place to reduce access and ban the recreational use of nitrous oxide. And if you don't know about this, so nitrous oxide is a tasteless gas. We commonly know it as laughing gas. It's used in dental offices to help you get a little bit more sedated before your procedure. It can also be used in the medical community for anesthesia, analgesic properties. However, it's very short lasting, and in the medical community, we monitor it very carefully, and it typically is mixed in with oxygen. What we're seeing, unfortunately, is that across the globe, because nitrous oxide canisters are available for the use of making whipping cream, people have used it for recreational purposes and are inhaling directly from that canister or using something to get the gas and inhale it. Unfortunately, this is problematic because it displaces B12, the vitamin B12, and also the forms of nitrous oxide that people are utilizing are pure nitrous oxide, so it can also cause asphyxia or low oxygenation rate. So long-term impacts of use can result in significant neurologic deficits. And a survey was, I actually had a survey conducted across Orange County clinicians and first responders to get a better sense of what they're seeing on the ground and what they're experiencing. And again, those who know of it as an issue are starting to see the negative impacts in those who use. And it does, unfortunately, have addictive properties. People in their middle ages who have been chronically using are seeing now neurologists with significant neurologic deficits. And we've also heard that canisters are in the community. So I'm putting it out here as my public message. If you see a canister like this, don't dispose it in your trash. One, educate your community that unfortunately this is a problem, and don't make it a waste issue. We do have recycling centers that will accept it. You just need to call them for further instructions on what to do. And again, do not dispose it in the regular trash. Also, it's time to start educating your kids and just anyone who's using that this is not safe. I know in social media it is all over social media, and there's a lot of stars that are using it and socializing it as a fun thing to do. I really don't think it is. And again, our hospitals are starting to see the impacts, including our children's hospital and our emergency room. So a report will be finalized and should be released later on this year for you all to read about. Next slide. Non-communicable diseases. As you saw, leading health diseases included cardiovascular disease, and we know that diabetes and obesity increases your cardiovascular risk. And even though we have a lot of great space for people to exercise and be out in the sun, we know it's a growing issue because it just is here in Orange County as well as the rest of the nation. You see that the percent of births where mothers had diabetes has been on the rise, and this is actually pulled straight out of our community health assessment, which we conducted in 2023, and now we're in our community health improvement plan. So this summary of diabetes and obesity in Orange County was directly from our community health improvement plan, and we have work groups directly working on this from across the county. So if you're interested, please join one of our work groups to help out with this, but I know there's other organizations also targeting reducing obesity in our community. Next slide. Ongoing challenges. Now we're going to go into my favorite topic, controlling infectious disease. So the good news is in 2024, 2025, we saw a significant reduction in COVID-19 illness and severe illness. However, and we also saw a reduction in respiratory syncytial virus, which, if any of you recall, I had to call a state of emergency because we were impacted several years ago because of the high rates of respiratory virus, syncytial virus that was affecting our pediatric community. Good news again, we have a reduction in that over the last season. However, as you'll see here in gold in the bottom table, influenza rates were high, and unfortunately, locally as well as nationally, influenza-related deaths have been the highest we've seen in years, and more specifically, pediatric deaths. So according to the CDC's preliminary estimated flu disease burden for 2024-2025 season, the flu-related hospitalization estimates were higher than previous years, as you see on that table, 610,000 to 1.3 million.
수가 아주 61만 명이 됐고요. 1점
If you can see there on the bottom right, all those years listed, those are the previous years of hospitalizations. And then the last flu season,
vì những cái cúm nó nhá.
May 9th, indicated that we have lost 226 individuals to influenza. And this is pediatric deaths. So this is the most the nation has ever encountered since 2009, 2010. I would be devastated if one of my children passed away from flu, because we know that there's so much that we have learned. There's so much that we can do to prevent severe illness, and yet it is still impacting our children. If you didn't see earlier this month, Riverside County public health officials report their first pediatric flu-associated deaths in the season, and San Diego County in months prior had adolescents, teenagers who died from flu. So unfortunately, flu is still affecting us. There's so much we need to do to prepare for the next flu season. I'd hate to say, I don't want to say that we have the amount of flu that we're seeing impacting and killing our children next year. So whatever we can do to encourage the public to do what they can to minimize their risk, please do so. We know that hesitancy and lower flu vaccination rates likely contribute to this increased flu burden, and there's a lot of other things, but that's definitely one of the reasons why we may have seen the significant rates of death. Next slide. TB control. So Orange County has a whole lot of TB, but especially at our early beginnings, we've had high TB rates, and we've typically surpassed the state just because we have a lot of people who contract TB when they come in from different countries. And back in our earliest establishment of public health, TB actually was from cattle, and there was a lot of efforts to detect and control TB in the cattle, and we went down from a rate of 74.61 per 100,000. Then that was in 1928. And you'll see here, now we're at 5.3 per 100,000. So we've come a long way. Even though we still have high rates, we've come a long way since our early beginnings. But that's because of all the different innovations, treatment and detection of latent TB. So all you clinicians out there, please continue to do your part to evaluate and survey for latent TB and to treat it. And if you have any questions, call our TB controller. We do have an amazing TB controller. She actually was a previous deputy health officer for Orange County and also serves in other counties as a TB to control TB. So thank you, Dr. Calvé, for all the work that you do, and all of our clinical team there who serve at our pulmonary disease services clinic. And again, this table is also available on our website. We're becoming modernized. We're sharing a lot of data, but it's all accessible on our website. So I do have good news on infectious disease as it connects to sexually transmitted disease. Next slide. You'll see here chlamydia cases are down, gonorrhea cases are down, syphilis cases, thank goodness, are down, but still affecting us. And unfortunately, we still have congenital syphilis, meaning infants are being affected by congenital syphilis, but good news is the rates are down. So thank you for all the clinicians out there educating our community to protect themselves and get treated if they have infection. And pox rates are also down. So I don't have the trends for newly diagnosed, but these are some of our numbers for HIV. We do have in our STD, our TTC clinic, test treat clinic service that provides services for sexually transmitted infections and also specifically for HIV treatment. Next slide. Hepatitis C. So good news is hepatitis C is also declining. However, I want to highlight and give this public message since it is May, Hepatitis Awareness Month. We do have 747 new cases of hepatitis C that was identified in Orange County 2024. And the good news is that treatment is available and it can cure. But that means providers, clinicians out there, you need to offer for people to get assessed to see if they have hepatitis C. And then if they do have hepatitis C, encourage them to get and seek treatment. There is a change in epidemiology, as you see here on the slide. Those under the age of 40, their primary risk factor was from injection drug use. And for those age 65 and older, it typically was from a variety of risk factors, but also from potential infected blood transfusions. And then, so again, just that was a public service message in support of May Hepatitis Awareness Month. Next slide. And talk about cancer. So as many of you know, like a lot of people are impacted by cancer. We're seeing a rise in cancer in certain groups. Good news is lung cancer, as you see that downward trend, has reduced. It's that top blue, because of all the great efforts that we've done to reduce tobacco use. But we do know that there's certain groups, specifically Asian, non-smoking groups, that have seen a rise in lung cancer. The good news is we do have researchers, even locally, who are looking more closely at why this is happening, but there's so much more that needs to be done. So this is where disaggregating data is really important to understand. And unfortunately, because I'm summarizing things, I'm looking at aggregate data. We also see all the other cancers, right? You see here, breast cancer is on the rise, and I unfortunately was one of those who was impacted. So females out there, please get screened before you develop symptoms. We have a lot of great hospitals that can help support you. Also, then you see pancreatic cancer for certain groups is actually on the rise rather than on the decline. Sorry, it is on the increase. And then you see prostate cancer on the decline, but still affecting many, and colon cancer. And just remember, our colorectal cancer screening has changed to 45 and older. So everybody get your colonoscopies. And then liver cancer for certain groups is on the rise. For the Asian community, liver cancers are on the rise. So there's so much more that we can do to detect and screen and treat for cancer. And again, depending on your ethnicity, there are different cancer mortality rates. So we see here the white community has had the highest cancer mortality rates compared to other races. But we also see that there are other groups like our Black community that do tend to have high rates. Next slide. This is just demonstrating the wonderful work in reducing tobacco. And this is a dashboard from our website, from our tobacco use prevention program. Next slide. I'm going to now go into emerging challenges. There are so many impacts on climate, on infectious disease, and I want to highlight some of them here. So we know climate change increases drought conditions, which then can increase valley fever. And I know you can't see the numbers, but you can at least see the trends on the table that's provided there. This is also from our dashboard, which we now have on our website, ochealthinfo.com/CDCD/data. And you can look at all the reportable diseases to understand what our trends are. So valley fever or coccidioidomycosis is the result of getting infected by cocci, which typically more is in desert areas, but you see the trend there. It's on the rise, even in Orange County. And then we know that with climate change, with the rains, with the weather, we have a rise in mosquitoes and vector-borne illness. So there on the right, you see dengue. And while we have not identified locally transmitted dengue, we have seen a rise in travel-associated dengue. So people who've traveled to areas with dengue have come to the county sick with dengue. And we know that our surrounding counties have identified locally transmitted dengue. So everybody needs to do their part to also reduce the mosquito population. And we know that I want to thank our mosquito and vector disease control division in Orange County and for all the work that they do to help keep the mosquito population at bay. But again, they also need your help in doing your part. So you can look on their website for more information on what to do. We've also seen a rise in foodborne illness and norovirus. I don't have the numbers here because that's not a reportable disease, but nationwide we've seen that. And then Legionella. So water quality, I didn't know where to put Legionella, but if you've seen some of our press releases, we've had a rise in Legionella. Legionella is a bacteria that can affect the water systems, especially water cooling towers, if they're not appropriately managed. And it can cause severe illness in those who are at risk. And again, you see a rising trend in Legionella. And then we know that we're experiencing the harmful algae blooms right now that's affecting our coastal lines and the sea mammals. So all of these climate changes are definitely having an effect, especially on on infectious disease. Next slide. Other emerging threats, H5N1 or bird flu. It's already impacted. I don't know about you, but buying eggs is really expensive. And it was because of bird flu. So this flu specifically impacted a lot of the poultry industry and the wild birds. But it's also affected cows and our dairy community. So, and we also recently did see that raw milk was infected with bird flu, and that raw milk that was ingested by cats significantly affected the cats that were ingesting this contaminated milk. So the county, the state, and the nation are using what's called a One Health approach. That means everybody comes together from human health to animal health and environmental health to try to find and solve this problem. The good news is that we have not yet seen that of person-to-person transmission. So far, it's really from contaminated and humans that were infected because they were in close interaction with ill animals, or and then for the animals that got sick, it was because they were in close contact with other sick animals or they ingested contaminated sources. So we're going to keep an eye on that. Our lab actually continues to get lab tests from our hospitals to survey for this. Next slide. We're also you're seeing it all over the news. We're seeing the resurgence of preventable illness, which includes measles. And the good news here in Orange County is that we have such a high vaccination rate amongst our children who are attending school that's probably protecting us from seeing an outbreak locally. But those who are not yet protected still have the risk of getting measles. So we know that there are communities who are not protected, and we're going to have to monitor closely for potential impacts to those communities. Where we're seeing in 2025 across the nation, we have well over 1,000, and that's likely a significant underestimation of how many measles cases are in the nation. We know other nations are also faced with a measles outbreak. So unfortunately, with lower vaccination rates, we can expect to see a rise in all of these diseases that are listed here. And measles, as you know, the measles, mumps, rubella vaccine does not just provide protection against measles, it provides protection against mumps and rubella, which can cause significant issues in the unborn child if a mother actually gets sick with any of those conditions. We also saw a significant rise in pertussis. The nation saw a rise in pertussis. You see there 32,000 in 2024. And we're, again, unfortunately going to see a rise in others. Next slide. This comes out of the Conditions of Children's report. And you see that in 2023, we had really good vaccination rates for the kids aged 2 to 5 who are enrolled in our child care centers and our schools. This does not account for people who may be visiting. It does not account for people who may be later on in or maybe no longer attending one of our schools. It doesn't account for the adult population. We actually do not know how many people are at risk in our community. So again, for those who are not yet protected, either because they have immune conditions that don't make the MMR vaccine effective for them, or for those who are not adequately vaccinated, those are the ones we are concerned mostly about as our nation faces the measles outbreaks. Next slide. Other emerging issues, silicosis. We actually in Orange County have well over 100 fabricated stone businesses, and this is our countertop business industry. And when the workers work on that fabricated stone to make it nice and smooth, it emits a silica dust. And when inhaled over a long period of time, as we recall in med school, causes coal miner's disease, silicosis, and can cause severe negative impacts to the point where people cannot breathe and may need a lung transplant. And unfortunately, we have already seen to date 60 cases of silicosis from fabricated stone workers since 2019. And unfortunately, that is likely the tip of the iceberg. Our TB control unit, our pulmonary disease services has noted more silicosis cases. So we need to do more educational awareness in the community of things that those workers can do to keep themselves safe. And there needs to be more surveillance and detection of the disease. And we as a county need to also work on the care pathway for individuals who are affected. This dashboard is actually from the California Department of Public Education, and June is Silicosis Awareness Month, so I'm hoping all of you on the clinical side will do your part. Next slide. Ongoing and emerging issues includes the natural disasters and potential man-made disasters. We know that with uncertainty, there comes increased anxiety, increased violence, so there's a lot more. There's also man-made disasters that are at play. But we also are dealing with climate changes that are bringing with them floods, rainstorms, but also significant heat patterns that can really impact us and cause also fires. So I need everybody to do their part to personally be ready and to know what to do in the event of a power outage, in the event of a heat or a significant weather change that will impact all of us, or an earthquake. There's My Shake. If you don't know what to do, these apps really help you know what to do in the moment. So really helpful. And also when there are fires, know what to do when the air is not so healthy around you. South Coast AQMD now has an app that features air quality data on a regular basis, so you know what to do in the case that the air is not as good quality as you'd like it, or if there's something going on, if there's a fire locally, or if there's smoke being pushed into the area that you're in, it will give you information on what to do. If you haven't already signed up, sign up for Alert OC to get the emergency alerts locally. We don't want to be like other counties where people don't have the alerts when they need it. And again, prepare yourselves, prepare your businesses for any natural disaster. Going into readiness and response, we have our emergency medical services team, which really helps with the coordination efforts. So they're not the ones on the ground seeing the patients. Our paramedics, our EMS staff, our hospitals, our clinical specialists across the county are doing so, but our EMS staff are behind the scenes trying to coordinate all that activity. We have grown to a county of having 31 hospitals, 25 emergency departments, and 5 trauma centers. So trying to coordinate where people go and how to make sure they have access is really the work of this team. And just more recently this year, this team actually received an award from the state for their groundbreaking bidirectional data exchange project, which allows for first responders to directly communicate to hospitals and the other way around, so that there's just better coordination of care once a person arrives in the hospital. And I want to make sure you are all aware that even though COVID, we haven't seen a lot of COVID cases compared to previous years, our hospitals have not had a break since the COVID pandemic emergency. They've just gotten better at seeing all the patients that are entering their hospitals. So I want to give you a number. In just this January alone, we have seen over 18,000 transports that occurred across Orange County. That is beyond what our county has ever seen. And during COVID times, we were maybe averaging anywhere from 12 to 15,000 transports, and that was during the COVID emergency time. We are no longer in that emergency, and yet we've seen over 18,000 transports in January for a wide range of reasons. So if you haven't thanked everybody on your first responders as well as your hospitals, your ERs, please thank them for really caring. And if you're still waiting in the emergency room for 2 or 3 hours, know that, again, our hospitals are doing an amazing job trying to care for the amazing demand that's put on them to see all the patients that are walking in their doors. And unfortunately, we know that with the uncertainties of people potentially losing insurance or becoming underinsured, our emergency departments will be more impacted. So it's probably more important now than ever to find different methods to make sure people know where to go for care, for them to continue their preventive care, and to understand when to use the emergency services. Next slide, probably what you all have been waiting to talk about. How have the national challenges impacted our local public health? Unfortunately, as a result of the federal funding reductions that included the epidemiology lab capacity enhancing detection and immunization and vaccines for children grants, we have had to make the hard decision of reducing some services. But that was after very careful planning and research. We know that we, over the years, have developed a community health system with the help of our coalition of community clinics and the free health clinics that are also in our community and the federally qualified clinics. They are really the safety network that provides the care and more comprehensive care than our public health team can do. So we have, effective May 6th, discontinued emergency dental services because we know that we were limited in what services we could provide, and it's probably better that a person who needed that tooth extraction go to a center where they can have comprehensive services and be cared for a longer period of time than just pulling out their tooth. So we want to first and foremost thank all of the federally qualified healthcare systems that surround us, our community clinics, our health network that have been providing the service. Thank you for all you're doing and doing that hard work. We are going to, again, refer all of our patients who come to us for those services to you. Also, later in June, we're going to unfortunately close our pediatric clinic. Again, similar to our dental services, we know that we have a lot of many different medical homes in the community that can provide more comprehensive care and continued care than we can. So unfortunately, that clinic is also closing. I know that many people have reached out to us hoping to help out and maybe even provide services at our clinic. There's still some challenges with those requests, so we're working through that. I want to thank you again for all that you do. Will our clinic still provide vaccines? Yes. Vaccines is core to what we do. So even though our pediatric clinic will be closing in June, we will continue to provide vaccinations. And then we will continue to provide pulmonary disease services because TB is one of those things that we are required to provide. And we also have our STD and HIV, our TTC clinic that is still providing services because it's core to what we do. Okay, moving on. There are so many great things that our community is doing. We have local initiatives, a lot of community health efforts. If you haven't seen our community health improvement plan yet, please do so. You can just Google up OC Health Info. We'll also put it in a link with this slide deck. We do have work groups, again, focusing in on the priorities for our county. And we're also working with our managed care plans and our hospitals to come up with a unified plan in 2028. So there's a lot of great innovative things that are happening to tackle all the challenges that we are faced with. Next slide. I want to harp on and make sure you hear this from me. Safeguarding our public health is not just our agency's responsibility. I think it's everybody's responsibility. We all need to work collectively to support one another through these challenging times. again, to protect our community. And we have such an amazing, rich county with so many resources, so many experts, researchers, scientists, businesses that really came here to innovate. And I'm encouraging all of you, let's come together, let's innovate to make things right for Orange County as we navigate these challenging times that are ahead. And next slide. So want to make sure also that you hear that I love looking at history. There's still so much for me to learn. There's so much for all of you to learn, but we can't make mistakes of the past. We need to learn from history to move forward. So I encourage you to really look back in the past just to learn how we can improve, and get involved. Get involved, encourage the community to get involved, get their voices heard of what they feel is needed. This is what we encourage all of you to do. We want you to be involved in our community health improvement plan. We want you to let us know what we can do better. We are limited with resources, but we'll do what we can with what the resources that we have. Next slide. So just these are some website resources and links. We'll make the slide deck available after the call and the recording available to all of you who haven't been able to listen in. And I'm going to, then there's one more slide. And if you can forward it into, follow us on social media. We're trying to get better at social media. So if anything, you might see me doing a little bit of yoga if you look on Facebook, since we just put an image on our anxiety challenge. And then the next slide, since cancer was really up there with the leading causes of death, I want you to know that there are many different resources outside of our agency that provide cancer dashboards. That includes our California Cancer Registry, as well as the UCI Child Family Comprehensive Cancer Center. Okay, got through all that. I am going to now open it up to our panelists. I know that there were probably some questions. I'm going to have my team help me out. I'm going to hand the mic over to Linda Molina, who is the Assistant Behavioral Health Services Director, because I know that there were some questions specific to behavioral health services. Linda, are you available to answer some of those questions that came up?
Yes, I can. Can you hear me okay? I did see the question in the chat, and it wasn't quite clear about the question. It had to do with overdose being the third most common for certain age groups, and that's true for the age groups 25 and older. Death by overdose was the third most common means. We don't have a clear link that mental health disorders has been established. It could play a role. There could be other social or psychological structural factors that contribute to that, but we don't have that data extrapolated. And were there other questions for me?
I think that's all. And then I want to highlight my deputy health officers and really thank them for all that they do in the background. I want everybody to see who they are. So Dr. Sheikh, if you can say hello to the community.
Hello, everyone. Dr. Sheikh, happy to be here and happy to support in any which way that I can and help in getting our county to a healthier, happier place.
She's been behind the scenes working a lot with our community, our hospitals, and also on the ground, meeting all of our community-based organizations, strengthening our partnerships. And you may actually see her sometimes teaching Stop the Bleed, and also interacting with some of our first responders. Thank you so much for what you do. And then we have Dr. Matthew Zahn, our infectious disease pediatric specialist and medical director for Communicable Disease Control Division.
Okay, good afternoon, everybody. Appreciate the chance to say hello, and I appreciate getting to serve under Dr. CK. She's a wonderful leader for our agency, and I'll just mention this part of our Communicable Disease Control Division. Speaking on their behalf, we appreciate all of the help from medical providers in all different situations that help us do our job and prevent spread of communicable disease in the county. So, thank you all very much.
And then I want to, Joanne Lim is on the call. So corrections is actually one of our bigger departments. They serve our jail community, and they've been doing a lot on the communicable disease side because they've been also screening for a lot of sexually transmitted infections. Joanne, say hi if you can, maybe. If not, that's okay. And then we also have our emergency medical services on the line, and they actually have updated dashboards also on our website. So I do see a question about the new strain of COVID coming to the state, and with the reduction of funding, how are we planning to tackle this new strain? It's basics, right? We learned a lot. We learned a lot about how we can prevent, and that includes mask. If you're going to see me out in town, you'll probably see me with a mask again. Well, I mean, I consider myself a little bit more high risk just because I do have a tendency to get pneumonias. So I will be doing that. And I know that we're all waiting to really get the official word from FDA and their committee and the CDC on what their expert guidance is on vaccines, and know that when their guidance comes out, it will be for the new vaccine. So right now, we do know that the COVID vaccine that is still available should offer protection against the new strain. Unfortunately, what we know is the newer strains are going to be stealthier. I mean, it's Darwinism at its best, right? The new strains learn to be stealthy, and that's how they gain control. It may not be as strong, it may not cause as much illness, but there's so much more to learn. We all need to do what we can to protect ourselves. And again, I showed you a whole lot of infectious diseases, so it's more than just flu and COVID. There's so many other infectious diseases we need to worry about. We need to learn how to prevent. And then also, we need to support our researchers to do the hard work of innovating and finding new solutions to help protect us. I do also see a question about dental prevention. While we are closing our emergency dental services, we are still focusing on working with the community to highlight the need for dental prevention. And I know that fluoride is a hot topic. So far, I haven't seen any changes in fluoride in the water, but we know fluoride does work. Unfortunately, in areas where fluoride is no longer used, what we see is a higher amount of dental caries. And in the long run, those kids unfortunately will have both emotional issues to deal with, right? When they have a metal mouth going to school because they had so many dental caries, or later on in life when they have cardiovascular illness because of all those infections that then went to the vascular system and caused issues. We know long term it's going to cause issues. So I know there's still a lot of that we're all looking at closely. And again, we have a great medical community, a lot of great medical associations who have been really proactive. And I encourage all of you clinicians who are on the call, if you haven't been getting in touch with your medical association, please get in touch because I'm working directly with them. And I do hold a call regularly to give them updates. We are 4 minutes to 1. We made it. I hope that this is the first of many annual state of health addresses that I will give to you. It is so important to stay informed. And again, I don't have all the answers, but I am happy to share the information so we can find solutions together.
Dr. CK, real quick, there was one more question. Is OC still doing wastewater surveillance?
So we are not doing wastewater per se. However, I think there's one area that the water is being tested for the state and the national site. So Dr. Zahn, can you clarify that? If you're still on.
So the state is the entity that runs wastewater surveillance. And when you say that, are we conducting surveillance, there's multiple different pathogens that are being tested statewide. That includes influenza, COVID, Mpox, and norovirus. I believe, and I'm trying to remember offhand, but I believe down in southern County, there are still wastewater surveillance for several of the pathogens. I admit, CK, I can't remember offhand which of those are being tested for. I think that I would note for people that while some of the funding has gone away for some of that testing, it is happening on a regional level, so both north of us and south of us. So we have data on all of those pathogens statewide and regionally as well.
Thank you, Dr. CK.
We did it. We made it on time. I was so worried we wouldn't. Thank you again, Orange County. Stay safe and stay connected.